Okay, so that's going to give you a slightly low-tech PowerPoint, which I think has appeared on everyone's screen. So I think the first thing I wanted to say was how great it is that people are showing up online to have this discussion now, because we've all got huge challenges going on in our work and our personal lives, and there's a lot going on for a lot of people. But actually, for me, it's really important to look up and to think as a way of getting through times that are difficult, like the time we were in, which is why I was so pleased to take up on Moni's offer to be part of this. So the early years system we have in England, I think, is an incredibly fragile system for the following reasons. First of all, we have a very fragmented system. So we have some children in early years settings, some with childminders, some in maintained nursery schools, some in early years provision in primary and infant schools. And although in theory, all of those different settings are regulated and inspected by Ofsted and covered by the EYFS, in reality, it's a very patchwork and fragmented system. And there are huge differences in funding and paying conditions and workforce, which make this a very fragmented part of our education and care system in England. A very stark contrast to countries in Northern Europe, for example, like Sweden or Denmark or Finland, which have a much stronger sense of a cohesive early years system, so that the type of provision you access isn't like it is in this country, so dependent on your postcode or your parents' income or the other things that affect childhood inequalities in our country. And of course, COVID has shown us that our system is financially very vulnerable. So many, for example, in Newham, where I work, mainly small private and voluntary settings, live really quite hand to mouth financially and very dependent on government funding, and then trying to cross subsidize with fees. And there's very little flex in that system. Despite a lot of hard work, there's little resilience in that system. So as soon as things start to go wrong, lots of settings are at risk of teetering financially on a very, very steep cliff edge. And of course, in addition to that, we're often quite a divided sector. So not long ago, when I tweeted something about welcoming early years children back to school after half term, I got a few people saying, well, what about children in settings? It's like, well, okay, you know, that wasn't meant to be an affront to kids in PVI settings and childminders. It just reflected the fact that half term was over for children in schools. And I think often we've struggled to get our voice heard in the early years because people have been able to play on the divisions between, for example, the school sector and the community voluntary and private sector. An overlooked sector. Boy, did people notice it, that schools got COVID testing kits and early years settings didn't, or that schools got access to PPE equipment at times, often when early years settings didn't. These are England's under 5 children. It doesn't matter, it shouldn't matter where they are, but it does. And parts of our sector feel taken for granted and overlooked at the moment. And we lack a coherent and progressive voice to speak with us and to speak for us. And I guess the final thing I'd say is something about the uncertainty of language at the moment in early years. So, for example, although any statistical generalization is always not true of individual cases, from a social equity point of view, it's really clear that kids in poverty were already pre-COVID at risk of much poorer levels of progress and outcomes in the early years, much more at risk of poor health and obesity. And yet I think we find these things very hard to talk about in the early years, and people are afraid that if they talk like that, they will somehow be devaluing the unique child, or that it's a deficit view of childhood. And that, I think, that uncertainty, rather than a confidence to speak and then an openness to be challenged about what you say, means that what we should be saying loudly and clearly to government, to the wider population, often gets rather lost in conflicts about language and appropriate sorts of discourse. We shouldn't be afraid to say that in our country, how much money your parents earn makes a huge difference to your childhood. That's not a deficit view of kids or families or working class cultures or Black and minority ethnic cultures or all the other things that it's sometimes accused of being. That's trying to create a progressive voice to stand up for kids and for families and for settings in our country who are getting a very raw deal at the moment. So I'm just wanting now to think about some of the things that we're learning as we're living in and through this pandemic period before a look ahead, if you like. And I would say here are kind of three of the really big messages. And these are the things that I feel optimistic about. First of all, the value of our normal, the things we do every day for children, the play, the facilities, the interaction, the way we love children to bits and treasure their individuality and their uniqueness and feel that great pleasure in inviting them into our settings and giving them enticing and exciting and dynamic experiences. All those normal things we do are unbelievably valuable to children. And of course, there are going to be some children who've suffered greatly during this period and who are going to need some specialist help. But actually, one of the things we've seen is that a very large number of children who've had a rough time through the pandemic have bounced back really well through the normal everyday things that we do in early years. And it reminds us of how powerful this provision is. I think we've also seen incredible depth and flexibility and resilience in our teams. We've seen people step up and take over leadership roles or adapt to a different way of working really fast or coped with a difficult situation with incredible calm and confidence. And I'm a great believer in our workforce in the early years. And it's been really great to see the workforce shining during this period at every level. So the leaders, the early years educators, the teachers and the assistants, I think, have really, really shone. And spirit and joy. I think that we don't sometimes talk enough about what the spirit of the children gives us and the joyfulness of the children gives us, and that sense that we're in a relational place. You know, we care for the children and we educate them, but they also care and love us and educate us and bring a lot of joy into our settings and into our lives. And I think a lot of people really noticed that when larger numbers of kids came back after lockdown, but it's always been there. It's just that I think sometimes we think that sounds a bit fluffy in early years to tell other people, but I would say we should never underestimate the importance of that human spirit and dignity and joy that we've seen in children and families throughout the period. So I really wanted to spend time thinking about the background and the context and the past to try and explain some of the things I think we need to be doing as we're building at the moment our future. And I think our future has, first of all, got to be much more integrated. So there's got to be a lot more equity across our early years system. And there's got to be a lot more teamwork as children move from one sort of provision to another. We need to revisit the integrated children's centre model and think really hard about how we get health and other services to work in that integrated way with children and families, because we've seen how when things get rough for children, we need lots of different people to step in and support on a temporary basis to help the child and to help the family through. I think we're going to need to put much more focus on children's health and emotional well-being in the early years. So in the corner of Newham where I work, which was worst affected out of the whole country by the pandemic in its early months, we've seen how the underlying health conditions that parents had led to very high mortality rates. But I'm afraid to say that this generation of young children in Newham is probably less healthy than their parents and more prone to respiratory illnesses because of the pollution that they suffer on the streets in London. And we've got to think big and ambitious about children's health and emotional well-being, both in early years, but also on the streets and in the parks and in the communities, and children having spaces to play out and be noticed and seen as active citizens in their communities and not hidden away in settings and families all of the time. I think we've got to do much more to link with parents and community and think about that whole picture of children's learning and well-being as we forge much stronger and more open alliances across the different parts of our early years system. And two quick final points. One is that we haven't put enough focus on the professionalism of our workforce. And now I think we've seen the vital importance of practitioners having that well of professional discretion and judgment and thinking to draw on, because no one told us what we were going to face, but people have coped because they've adapted quickly, and they've adapted quickly because they're thinkers and because they're professionals. And we need to do a lot more to re-emphasize the professionalism of our early years workforce and to give people better quality professional development opportunities so that that becomes more widespread across our sector. And finally, I think we need to see that progressive alliance, which stands up for young children and for their health and their well-being and for family life in England, because we've neglected that for far too long, and we've run our early years on a shoestring for far too long. And now I think is the time for progressive people to come together and to say, actually, this is not a marginal or Cinderella service anymore. This is integral to family life and the functioning of our society, and it should be seen as such. And I'm really optimistic that that is the future that we'll be able to build for ourselves.